So what are the etiologic risk factors in the development of hepatocellular cancer? We all know that hepatocellular cancer or liver cancer is caused by chronic irritation or inflammations. And usually the most common causes of these irritations or inflammations are viral hepatitis, like hepatitis B and C, because these are the viral infections that can cause chronic infection. Other etiologies could be alcohol irritation, people who drinks a lot of alcohol intake. And recently there is the incidence of NASH, which is non-alcoholic steatohepatitis, which are associated with obesity. There are some rare causes that can cause liver damage, and these are autoimmune problems, genetic problems like alpha-1 antitrypsin deficiency or hemochromatosis, and some aflatoxin exposures. But the most common agents are viral hepatitis, alcohol, and NASH.
Concerning the global trends in incidence and prevalence of hepatocellular carcinoma, we see in most countries a rise in incidence and in prevalence. There are some countries, for example, Japan would be one, where there has been a decline. This is related to successful treatment of hepatitis C virus and the resulting cirrhotic complications in these countries. But for most countries, we indeed see a rising incidence. This is in most part explained by the increasing incidence in NASH, in non-alcoholic fatty liver disease, and in the resulting complications from NASH cirrhosis. Problem here is that we increasingly see non-cirrhotic patients with NASH developing hepatocellular carcinoma. Yeah, we see still most patients with a viral background, hepatitis C, and then followed by hepatitis B patients. In many European countries, alcoholic liver disease is a main contributor as well. And in recent years, we saw an increase in what has been in the past considered to be cryptogenic cirrhosis. We had no explanation, and then learned that this is basically a fatty liver disease, and NASH is in these days increasingly contributing to hepatocellular carcinoma incidence. We expect that hepatitis C virus-driven hepatocellular carcinoma will decline in response to successful treatment. And there's a continuous contribution of hepatitis B virus patients. Of course, we have vaccination, and the more successful vaccination is applied, the less hepatitis B virus will occur. This is something which is resulting in a certain decrease in numbers in, for example, China. But as we are not perfect in these settings, we still observe hepatitis B and hepatitis C driven hepatocellular carcinoma.